சிறப்பு விருந்தினர் டாக்டர் திரு அனில்குமார் ரெட்டி, கன்சல்டன்ட் இஎன்டி சர்ஜன், ஹோமியோபதி மற்றும் அக்யூபஞ்சரிஸ்ட். எல்லா வகை மருத்துவ முறைகளையும் கற்றுத் தெரிந்த அறிஞர். அத்தகு மாமேதையை சிறப்புரையாற்ற முன்வருமாறு அன்புடனும் வணக்கத்துடனும் கேட்டுக்கொள்கிறேன். எங்கள் அசோசியேஷன் நண்பர்கள் சார்பாக வருக வருக என வரவேற்கிறேன். அவருடைய படிப்பு, அவருடைய அனுபவங்கள், அவருடைய தொகுப்பு, நிகழ்ச்சி தொகுப்புகள் அனைத்தும் ஸ்லைடாக காட்டப்படும். அவற்றையும் கண்டுகொள்ளலாம்.
Good morning and namaskarams to all of you. First of all, I want to congratulate and give my best wishes to the Reiki Center of India, Chennai, on their celebrations 25th World Reiki Day, Reiki Conclave 2024, a two-day event being conducted on January 6th and 7th in Chennai. I bow to the feet of the founder, Dr. P.S. Lalita Madam Garu, for inviting me to give my honorary guest lecture on this 25th World Reiki Day celebration in the Reiki Conclave 2024 in Chennai today. My sincere thanks to R. Sridevi Garu, President, Mrs. Vasanthi Karthik, Secretary, Mrs. Saraswati Kalyana Sundaram, Treasurer, all executive members of Reiki Center of India, and all the students and who was associated with this association since more than 25 years with P.S. Lalita Madam Garu and taking this as a mission on their spiritual journey. My sincere thanks to Mrs. Kala Bhashini Garu for taking a special time to come to my clinic personally and invite me, giving an invitation and presenting me a memento. Thank you, madam, and thank you, all of you. Today's my topic is on Reiki, how it is used in the modern times as an energy medicine through the subject as radionics, which is being practiced in Hyderabad since more than 2 decades. Radionics is remote, its full form is remote ailment diagnosis in organism neo-instrumental curing system. Treatment itself is through by giving powered homeopathic pills or broadcasting to the witness, usually a hair sample or photograph of the patient with the aid of an instrument, no matter where the patient and practitioner are geographically located. They can be together or many miles apart. We can use the hair sample or photograph of the patient, or else we can use the thumb impression, signature of the patient, sputum of the patient, blood spot of the patient, or nails, fingernails of the patient can be used as the witness of the patient. So any of the witnesses can be taken from the patient and they can be treated radionically from your clinic itself without the patient itself coming to you and receiving the treatment. So it is through Reiki which goes through this healing system once again and does this miraculous healing effects. I sincerely bow to Masters Mikao Usui, Chujiro Hayashi, Hawaya Takata, and all the healers and all the Reiki masters who made me my spiritual journey into radionics since more than 2 decades. I became a Reiki channel in the year 94 in Hyderabad, where I did my Reiki 1. After initiation, they asked me to see them after 2 months. So during these practice sessions, I I was just practicing one day in a homeo clinic where a man came to a homeopathy stores to purchase a homeo medicine. He developed blue and completely there was a heart attack immediately. I could suspect something is going on. Then immediately, because I was just completed my M.B.B.S at time and Reiki was in my hands. So I just, without knowing anyone, I just surrendered to Reiki and started rubbing his palms and soles and transmitted Reiki. And after few minutes, the patient could revive. And then I asked him to see a cardiologist. So he went and shown to a cardiologist where he got his electrocardiograph done and showed it was normal. Even the trace of heart attack couldn't be detected on ECG. So that was my spiritual journey into radionics and Reiki. From then, it is continuing till now. Radionics was originally developed in San Francisco by Dr. Albert Abrahams in 1863 to 1924 and has advanced over years as a result of his dedicated efforts of many practitioners and a number of outstanding personalities such as Ruth Brown from USA and David Tansley and Malcolm Ray from United Kingdom. The United Kingdom is the main source of radionic therapy practice in the world, and now it has spread everywhere in the world today. Radionics is an advanced complementary therapy in which the practitioner uses pendulum dosing. This is also known as radiesthesia and radionic instruments to discover and correct the energy imbalances in the patient. These imbalances can result from many possible causes such as emotional shock and other emotional difficulties, exposure to toxic substances, viral infections, nutritional deficiencies, allergies, and so forth onwards. In some cases, there are impacts result in deep and long-lasting health problems which may defy orthodox medical solutions. So even such where we cannot diagnose through X-rays or blood tests or stool examinations or CT scans, such things can be found out in the energy system of the patient using pendulum diagnosis. and just finding the cause where the root cause of the ailment is located and start giving our Reiki healing through radionics and other instrument. Finally, you yourself become a radionic instrument after doing a lot of sadhanas. In practice, the objective of radionics is broadly speaking to enhance the body by strengthening the patient's immune mechanism and self-healing capacity to remove harmful poisons and toxins, and to increase the patient's energy and sense of well-being, not only at the physical but also at the emotional, mental, and even at the spiritual levels. In addition, in common with homeopathy, radionic holds that each person has just an aura or the vital force or energy field around him, which, when disturbed, results in symptoms in the physical body. Thus, radionic treatment attempts to reorder or retune the personal energy field. This is known as normalizing. In addition to direct energetic counterpart to the physical body, the radionic model also includes what is termed the subtle anatomy, which comprises the etheric, the emotional, the mental, and spiritual dimensions of the human being. Radionics therefore recognizes and utilizes many concepts from Asian and Oriental medicine, such as chakras, energy centers from yoga, meridians, and energy pathways from acupuncture. Tuning in. It is not necessary for a patient to be at present for the practitioner to tune him or her. Something unique to the patient, such as the signature or hair sample or photograph, may be used as a proxy or witness. Thus can happen, we believe, because part of the mind of each of us is linked via universal mind. The universal mind seems to function outside the familiar space time framework of our day-to-day lives, and that is why it does not matter whether the patient and practitioner are geographically located. They can be together or many miles apart. How radionics healing is carried out. In order for a practitioner to carry out the analysis and the treatment, the patient completes a case history and gives his or her consent. All information provided by the patient is held in strict confidence. Practitioners use an instrument to both analyze and treat physical and emotional weaknesses evident in patients' subtle energy field. Understanding this field requires extensive study. The instrument seems to focus. Here, the instruments, we ourselves will become instruments because of the sadhanas that we are doing in day-to-day, our spiritual journey in radionics. So understanding this field requires an extensive study. The instrument serves, yourself an instrument, serves to focus the thoughts of the practitioner, and many types are in use, varying in complexity from computerized machines to quite simple devices. Once the weakness in the subtle field have been identified, special healing treatment is given, covering fungi, parasites, poisons, toxins, diseases, and factors which may counteract the problem are conveyed to the patient, represented by the witness, independent of time and space, with an aid of instrument. What do you expect during radionic treatments? The first sign the treatment is working may be an increased feeling of well-being. An improvement in physical symptoms usually follows. If you have been ill for quite a long time, it takes several months of treatment may be needed. It is advisable to keep in regular contact with your practitioner during your treatment in order for it to be as effective as possible. Radionic treatment can also be useful for those suffering from chronic or terminal illnesses. This treatment is more beneficial because no costly drugs are used. No costly drugs are used and are used and is effective. It is very, very economical, safe, simple, and being free from side effects. I'm practicing in Hyderabad since more than 2 decades now. This is where my treatment room where I use my radionic instrument. Can everyone see?
Yes, sir.
This is known as radionic black box. The instruments are in three categories. One is base 10, one is base 44, and one is base 336. Base 10 acts on physical body. Base 44 will act on mental body. Base 336 will be acting on spiritual body. So when the patient comes to you, so first we as a witness, we have to take either patient signature or hair. Actually, hair sample I used to take before. And these people has to have doubts, sir, something is going on. But later, well, nothing to worry. I am a doctor. I won't do such things. But still, then I changed to photograph and then signature of the patients. Even the thumb impressions, we can take it as a witness. Here, in this instrument is a base 10 instrument where we have got dials. Dial 1, dial 2, dial 3, dial 4, dial 5, dial 6, dial 7, dial 8, dial 9, dial 10, dial 11, and dial 12. Dial 12 dials are there with the numerical 0 to 10. So each dial will have 10 numericals. And we have got one sample, one well as a sample and well as for the outlet. And there are few switches, one for the off, for offing the electricity, and one for the oning the electricity on for the treatment. And these a small knob is present where you can tune in. And if the current blow electric supply, we have the battery also. So what the first thing? So we do, we take the witness from the patient, could be a sample or signature, and through down using the pendulum, we take what the patient's problem. Could it be anything? So, for example, I am giving one small this thing. Suppose the patient has been indicated with the suppose Agna Chakra has been affected in the patient. So there is a book by Radionic Rates by Sri Ivan Kumbe sir, the great sir, who has done a lot of research on this by making rates of any matter to from bacteria, from viruses to fungi to so many things, including mantras, subtle bodies, yoga, meridians, chakras, commands, gems, gem mixtures, waves, hormones, bacteria, amino acids, enzymes, metals, carbons, body parts, subtle bodies, chakras, endocrines, cranial nerves, psychological, toxins, virus, detrimental, pollution, radiation, elements, vitamins, venom, acids, and elements. Even all biological body parts, anatomy has been made into rates. Even muscle, blood, tissue, then you have bones, nerves, and so many things have been converted into rates so that you can use specifically for the patient, whether it is suitable for his physical condition or mental condition or his etheric condition. Then homeopathic notes are also made with these rates for the diseases, and very important of all, Dr. Swami Narayani, Swami Ananda of Soham Foundation, Vadodara, Gujarat. They have developed a lot and did an excellent service to the humanity by discovering the mixtures, Swami Narayani mixtures, which can be used in radionic instruments and start healing the patients. So after the diagnosis, I keep the homeopathy pills in this bottle, and in the output, I keep the patient's photo sample and start radiating the energies. So when once it gets started, the healing begins and flows from the rates. The rates which I kept it, suppose Agnya Chakra rate I keep here, and the Agnya Chakra rate will be converting into the medication bottle in the homeopathic sample, and it will be transferred to the patient, whether signature of the patient or the hair sample in the second output well. This is how radionic treatment is being carried out. One more example I want to tell you. One of my friends, professor in anesthesia, has been suffering from COVID. So there was one incident during this COVID period where my classmate, she's a gynecologist practicing in Mysore. Her husband is an anesthesia. department head of the department. They all went for Coorg and they got immersed in one river in Coorg. So all they developed COVID symptoms. Their wife and children, somehow they got healed and they recovered. But this man developed upper respiratory infections and all COVID symptoms, and he was found to be very positive. And there was 95% lung damage, which was seen by pulmonologists in Apollo Hospitals, Mysore. So he was on near to ventilator, but he was on oxygen treatment, and they were giving antibiotics, steroids, and all those things. When his wife requested me, she is being a classmate of me, can anything you do, Anil, through Reiki? I said, I will try myself. We'll surrender to God and at least we'll try to help him. So I just prayed God and started seeing his aura and I've checked, and the doctors told, now it is very difficult, sir. In another 1 day, I think we'll just wait or we'll put him on the ventilator. That's the only thing. 95% lung damage has been found on the CT scan of the chest. So what, then they started, I said, they said, sir, we are giving you permission to start your treatment from Hyderabad. As they requested, I started my treatment and from Hyderabad, and all Uparwala and Reiki has done all. So the first thing I give, first giving installation of confidence to him, first of all. So what I did, I gave a batch flower remedy. The batch flower remedy, large for confidence. I started instilling him first confidence in him. Later he was feeling very weak. Then olive has been given to him. This is all through Radionics, madam, through the mobile phone, going into the ICU, and he's catching a bottle of water in the ICU, sitting on the bed in ICU in Apollo hospitals. So after seeing the thing aura, I could see a lot of lung damage. So I used the homeopathy vibration silesia in CM potency and transmitted to the water bottle which is holding in the room of the ICU. And 2-3 for cough, I've given Senega homeopathy remedy and few other remedies. And he started taking step by step, day by day, he was improving. And on 1 week, he was out of the hospital with 4 liters of oxygen and to be carried to his house. And he used to be on oxygen mask. Slowly, he started improving rest, and within 1 week, he recovered, madam. Thanks to Reiki, thanks to the masters, and thanks to the healing energy. So I conclude my lecture. Thank you very much for giving me an opportunity to talk to you all and enlighten on Reiki. Thank you very much, madam, to all.
திரு அனில்குமார் வாசிரெட்டி அவர்கள் தன் சிறப்புரையில் மருத்துவ முறைகளையும் தன் அனுபவங்களையும் தெள்ள தெளிவாக விரித்து உரைத்தமைக்கு மிக்க நன்றி. ஒவ்வொரு வருடமும் ஹீலிங் ஹேண்ட்ஸ் என்ற புஸ்தகத்தை பிரசுரித்து வருகிறோம். 25 வருடங்களாக சிகிச்சையாளர்கள் தங்கள் அனுபவங்களை அப்புஸ்தகத்தின் மூலம் வெளியிடுகிறார்கள். இந்த வருடம் இந்த தொகுப்புகளை முழுமையாக தேர்ந்தெடுத்து தொகுத்து அதை விஸ்பர்ஸ் ஆஃப் வெல்னஸ் ரெய்கி காம்பெண்டியம் என்ற ஒரே புஸ்தகமாக வெளியிட்டுள்ளனர். அதன் முதல் பிரதியை டாக்டர் திரு அனில்குமார் வாசிரெட்டி அவர்களுக்கு சமர்ப்பிக்கிறோம்.